Topic is Payr's crushing clamp. Hello students, we will discuss an instrument today. Just see what this instrument is. So look at that. Stout, very stout instrument. Crocodile-like jaw, the tip. See that? And very three-dimensional lever system. See that? Three-dimensional lever system. Very stout handle. And it locks very well when you press it like this and opens widely. Sometimes there will be a pin in the tip. So very stout instrument. It is chromatic, stout, crushing clamp. Traditionally called as gastric crushing clamp. Payr's crushing clamp. P-A-Y-R apostrophe S, but pronunciation is Payr's crushing clamp. Spelling is different, and it is used to in gastrectomy. Also used in any resection anastomosis. Applied part to be removed, and so once you apply this one, viability of that bowel will be lost. So it should be very decisive before applying, using this instrument, before placing this instrument, because this is a applied part to be removed. Certain areas it applied in situ actually, like duodenal stump closure applied and underrun. Sewing machine suturing, when you do underneath the instrument, this is used. Also when you create the lesser curvature after gastrectomy, partial gastrectomy, then again we use this instrument. Different sizes come, small size, medium, very large, very large size also, very stout instrument comes. It holds the bowel very well actually, prevents any spillage, but crushes. It is not occlusion clamp. Occlusion clamp occludes the lumen, occludes the bowel wall for bleed. So it prevents temporarily to prevent the bleeding and spillage, but it doesn't cause any damage to the viability of the bowel. So you can always apply that one to the part to be retained. Whereas here you can't apply to the part to be retained or part to be anastomosed. You can't use this one. You have to use only occlusion clamp. Part to be anastomosed, occlusion clamp. Part to be removed, crushing clamp. Should not use this one part to be anastomosed. That's the point you have to remember. It is Payr's gastric crushing clamp or Payr's intestinal crushing clamp. It's very stout instrument, always kept in the Oxy exam. You should know both PGs and UGs. Instrument should be known. So all these things I have told already. Jaw like that, continuous sutures you can apply. So it is a hemostatic also in many areas. Even in cardiothoracic surgery they use it as a hemostatic, because clamps, even once you clamp it, it's completely seals the vessel. So it is hemostatic also, this instrument. Very strong instrument, especially GI surgery, sometimes cardiothoracic surgery. Very, very useful instrument in major surgeries. Remember, that is Payr's, spelling, remember P-A-Y-R-S. Pronunciation is Payr, spelling is P-A-Y-R. It's a crushing clamp, not occlusion clamp. Again, that point you have to remember always. So for the instruments, read my manual of surgery and clinical method surgery. Details always given for other occlusion clamps, other retractors, other crushing clamps. So students, again, I request all of you to subscribe my YouTube channel and share your channel with your friends and colleagues, and upgrade your surgical knowledge daily, on day-to-day, daily basis, for 5 to 10 minutes, brief lectures of different topics, especially case scenario, images, instruments, post-operative complications, operative procedures, briefly everything, different aspects. Wide surgery is a very wide area. So small topics, daily basis you can learn. It will be more interesting and easier to remember. And also my live session once in 2 weeks or once in a week, which comes where students will present a case. So your practical exam will be very useful. 1.5 hours live discussion, case presentation, discussion, interaction, and management aspect. With not only with me, with the senior professors joining the live session, very useful for you. And also those who have joined the live session will give a certificate. It will be again very useful for your future. Again, request you to subscribe my YouTube channel. Please subscribe my YouTube channel. Very, very useful for you, and share with your friends. So identify this instrument, answer this MCQ in the comment box. I will acknowledge your answer, student, please. And what is the right answer? Find out, put it in the answer. And second answer, what is this answer? MCQ is identify this instrument again. So what is the right answer? Again, I'll get back to you. Quotation of the day is: it is not enough if you could swallow something, but it's equally and more important that you should be able to digest it. So that is a very important quotation. It's not everything you try to do. It is whatever possible. You should decide what is feasible and what is possible to you. You can't take everything, then you can't make it. You can't do, when everything is half-hearted, half-effort, then it will be haphazard. Won't it? It may be methodical. What you able to digest, swallow it. but you don't able to diagnose, don't swallow it. It is very again useful in surgical field. This is the quotation of the day. Students, I request you to subscribe my YouTube channel and share with your friends and learn daily, go through my daily day-to-day lectures with the MCQ, two MCQs and one quotation, and join my live sessions at regular intervals for you to upgrade your surgical knowledge. So students, I hope you have understood this lecture very well. Thank you so much.